Anemia. Anemia is a group of disease characterized by decrease in either hemoglobin or the volume of blood cells, which lead to decreased oxygen carrying capacity. Now, what are the types of anemia? Anemia is classified into three types: microcytic anemia, normocytic anemia, and macrocytic anemia. So, what are the sizes of RBC in various anemia? In microcytic anemia, the hematocrit volume will be less than 80 mu cubic meter, and in normocytic anemia, MCV is 80 to 100 mu cubic meters, and in macrocytic anemia, MCV would be more than 100 mu cubic meters. What happens in the microcytic anemia? There is decreased HB production and extra division of HB takes place for the maintenance. Its types are iron deficiency anemia, anemia of chronic diseases, sideroblastic anemia, and thalassemia. And in normocytic anemia, RBC size and shape remain same. And what are the causes of normocytic anemia? Hereditary spherocytosis, sickle cell anemia, G6PD deficiency anemia, microangiopathic hemolytic anemia, or malaria. Now, what macrocytic anemia? In macrocytic anemia, there is decrease folate and decrease in vitamin B12, which lead to abnormal size of the RBC, leads to macrocytic anemia. What are the causes for the macrocytic anemia are megaloblastic anemia, alcoholism, liver disease, and various drugs. Now, describing specifically single anemia, like first we talk about the sideroblastic anemia. Sideroblastic anemia is associated with the lead poisoning or excessive alcohol intake, or it can occur because of the antitubercular drugs. In sideroblastic anemia, there is iron deposition in the perinuclear area, which give it a sideroblastic appearance. Now, moving on to the megaloblastic anemia. Megaloblastic anemia, when the RBCs are big and oval, leads to condition macroovalocytosis, and also when the WBCs has more than 5 nuclear lobes, hypersegmented neutrophil are seen. What are the causes for it is B12, folic acid deficiency, and administration of certain drugs. What happens in it is, due to B12 deficiency, there is a demyelination affecting the dorsal column of the spinal cord. So, manifestation can be both, like presence of megaloblastic anemia with neurological manifestation, or it can be without neurological manifestation. Now, moving on to the hemolytic anemia. Hemolytic anemia includes like spherocytosis, G6PD deficiency, sickle cell anemia. In spherocytosis, their RBC become spherical shape and no central pallor is seen. Causes can be due to autoimmune hemolytic anemia or due to hereditary spherocytosis. Now, G6PD deficiency, it is an oxidative stress condition which lead to the denaturation of the hemoglobin, which going to result in the precipitation of hemoglobin inside the RBCs, and these RBCs known as Hinge body. Sometimes these Hinge body during the circulation through the spleen get engulfed by the macrophages, leading to the bite cells, which are characteristics of the G6PD deficiency anemia. Now, it is now say sickle cell anemia. Sickle cell anemia is a hemoglobinopathy, globinopathy that result because of the point mutation. It is also known as sickle cell traits, also known as metabisulfite, that so that sickling can be observed. There is a presence of fibrotic area in the spleen, which are having calcium deposit, also known as granny gamma bodies. Diagnosis of sickle cell anemia is made by the hemoglobin electrophoresis, high performance liquid chromatography, and thalassemia. Now moving on to the thalassemia. It is thalassemia. There is a presence of hepatomegaly and splenomegaly. Peripheral smear will show the microcytic hypochromic cells. Target cells are seen. Crew, cut, or hair and on appearance seen on the X-ray. Now further, angiopathic hemolytic anemia. It is characterized by the deposition of clot in the blood vessel, which is responsible for causing physical damage to the RBCs, which lead to the fragmented RBCs like the schistocytes or the helmet cell appear in the blood. Now moving on to the investigation parts. Investigation required complete hemogram with HB, in which various blood indices are observed like hematocrit volume, HB, RBC number, WBC number, and platelets number. According to that, we can distinguish which type of anemia is, like whether it is macrocytic, normocytic, or microcytic. Also, we will do the peripheral smear to look out the size of the RBCs, and also if there any anomaly of the size of the RBC is present. So by the staining method, we can assess whether it is hypochromic, hyperchromic, or normochromic. Also, we can see the target cells, which is due to deposition of HB inside the RBCs. Now diagnosis is done. Also in sickle cell anemia, we can do electrophoresis studies or high performance liquid chromatography are done. And in thalassemia, tests are done, screening tests are done, Nestrov test is done, and also X-ray of the face, nasal bone, maxilla, and jaw to see the prominence. Now moving on to the management part. Management is done accordingly by assessing the proper cause of the anemia. So after detection of the underlying cause, treatment is given. Like in iron deficiency anemia, we will give the iron supplement, and in folic acid deficiency anemia, we will give the folic acid supplementation. And also for the thalassemia, we will give the blood products. And in G6PD deficiency, no treatment is required. This is a self-limiting condition. That's it. Thank you.